faster for any patient. So with the terion lenses, there is no compromise.
Challenge really there is actually meeting patient expectations and being able to explain what we can achieve after the surgery. There are different kinds of lenses that we can use, and the main goal there is really patient satisfaction.
And that's what all the terion lenses is about. It makes all the patients are very, very happy. And that's why I think this is the lens where you should go, and every patient should have such a lens in their eye.
So, if you are looking for an IOL experience like no other, get in touch with us and find out how Tilion can take your premium cataract practice to the next level.
Hello everyone, I'm Dr. YY Chung from Malaysia. A very good welcome to everyone for this lunch convention meeting. I'm a co-moderator for today's meeting. So this symposium is going to be a deep sea dive into the limits of cataract surgery and discovering personal experiences of optimal spectacle independence following cataract surgery. The program will involve some participants who are going to present their personal visual experiences, and the interchange is intended to be frank and robust, as well as entertaining. So we would like to proceed with the program. Please enjoy. Thank you.
Hi, I'm Dr. Ruben Aquino. I am a 73-year-old practicing ophthalmologist in the Philippines. I underwent femtosecond laser-assisted cataract surgery on both eyes 9 years ago in 2016. Just like any patient, I wanted to have the best surgeon.
Hi, I'm Cesar Espiritu, an eye surgeon from the Philippines. My subspecialties are cataract and refractive surgery and cornea, external diseases, and uveitis, for which I took a fellowship at the University of California in San Francisco. When Jojo Aquino first mentioned the possibility of his having cataract surgery done, the first question I asked was, why?
Just a slight change, particularly in the way I do surgery. When that happened, I chose to have early surgery because my surgery is my life.
And of course, he mentioned his difficulties as far as his vision. In particular, he's having problems with depth of focus during his surgeries. He mentioned that he really wasn't problematic with his daily activities. It was just his surgical challenges as far as being able to see, for example, capsulorhexis, doing the capsulotomy, that really egged him to consider having the cataracts removed and an appropriate IOL implanted to improve his vision.
8 years ago, we already have femtosecond laser-assisted cataract surgery. We already had EDOF lenses. And I knew that by the history of what I wanted to accomplish, I needed good distance vision. I needed an expanded intermediate range. And I also needed a little bit of near vision on my dominant eye. This is because what I want to accomplish in the form of sports and distressing in my surgery and practice, I needed to play pool well enough.
Well, Jojo being an eye surgeon himself, the pre-op diagnostics and measurements had to be meticulously done. This included, of course, biometry or the actual measurement to determine the IOL power. In particular, and involving that was doing the accurate measurements for the corneal curvatures or case, the anterior posterior length of the eyeball. We also had to do specular microscopy to make sure that the corneas were healthy. We also had the fundus examined, so make sure that retinas were okay, macula was fine. All those things we really do as a standard procedure in all patients. And all of these we did 5 times just to please Jojo and to make us secure about accuracy and that we will be able to deliver the expectations Dr. Aquino had as far as his visual results. And mind you, this is standard for all the patients that we do because it's very important that you end up with patients who are satisfied with the results.
At this point in time in 2016, there were only diffractive multifocal intraocular lens implants and the introduction of refractive lenses. It was evident from my visual demand that I wanted to avoid glare, halos, and dysphotopsias associated with diffractive designed intraocular lens implants. And that's the reason why we chose a refractive lens to give me good distance vision, an expanded intermediate range, and a little bit of near vision.
As he mentioned, he needed a very clear distance vision because of his want for his practical shooting. He also needed intermediate vision because of his being able or want to be able to focus clearly on the sight of his gun for practical shooting, and of course being able to see the cue ball when playing billiards, as well as the target ball. So all of these were being considered in in uh, in addition to, of course, his visual requirements for doing good surgery. And with all of these in mind, we chose for the first eye, his dominant eye, the LENTIS Comfort IOL because this ensured a very, very clear, waxy-free distance vision and being able to give him the extended intermediate vision that he wanted for his dominant eye.
I had my surgery at around 8 o'clock in the morning, and by mid-afternoon and early evening, I was already seeing very well. So I was extremely happy with this. And in a period of about 3 months, I decided to have my other eye done.
The second eye, after seeing the results of the first eye, he wanted a little bit more reading. And that's why we decided on using the M+X lens, which had a higher add power. In combination, these two actually gave him an extended and seamless depth of vision from distance to reading. And that's how we used these lenses in his eyes to give him that kind of vision that made him a happy patient afterwards. Well, a day after the surgery, I just had to see Jojo, make sure that he was fine, and everything was fine. He was seeing very well. He had a slight transient increase in pressure, which probably caused some discomfort, a little glare, which actually improved when his pupils came back down to its normal size. And then he went back to Cebu. And because he had an active practice there with great partners who were also ophthalmologists, they were the ones who actually made sure that he was fine until full healing happened. Now he has great vision, probably vision as good as a 30-year-old or younger. So maybe Jojo can fill us in. How have you been, Jo, since 9 years ago when we did the surgery?
9 years after, I see very well. I am spectacle free. I see distance with a seamless transition to intermediate and seamless transition to near vision. So I'm spectacle free all day. The transition from distance, intermediate, and near is seamless. And I'm very happy with that and thankful for the manufacturers of the lens implant, thankful to my surgical team composed of Dr. Cesar Espiritu, Benji Cabrera, and Rich Fu.
Hi, good afternoon. Yeah, just a few more comments. Maybe I think Jojo explained to you already the factors for the choices of the lens. No? If you can imagine 9 years ago, and even up to today, concern is really the decrease in the sharpness or contrast of vision. And that's why the segmental bifocals are actually very ideal as far as maintaining very clear, waxy-free vision, because they only have a decrease of about 7% in MTF. The reason for the choices of the add powers, now we have EDOF lenses that really make more intermediate better and also decrease the loss in contrast. But at that time, if you really spend a lot of chair time with Jojo or with your patients, as we did here, we really identified his need for intermediate range because he was a pool player and he was a practical shooter, so he needed to focus at the gun sight. And then, which is also what I do for my patients, after implanting the Comfort or the EDOF lens, I ask the patients, are you happy with it? If they say yes, I put in the same lens in the second eye. You know, why change what ain't broke? No? But if, like Jojo, they say they want a little bit more near vision, then we put in either the MF20 or the MF30. And that way, the seamless range in vision is achieved. Yeah, maybe I should open the floor for some questions if you have any before we go to the next presentation. If you don't have any questions now, we can always ask them later. Thank you. Oh, Dil just reminded me, I also did the same thing for my wife. And you can imagine the stress when I did that. Having to live with somebody who will complain to you every single day is no joke. But I was so confident with the lenses, so that's how the story went. Thank you.
Good afternoon. I think I don't need to introduce myself, but I'll have Dr. Jean Yusi here say a few words about what he does and his specialty and the difficulties he encountered when he came to see me.
Okay, I'm Dr. Jean Linus Yusi. I'm a urologist practicing for 27 or 28 years now. I was also the chairman of the Department of Urology in the National Kidney Transplant Institute. I'm now the chairman of the Philippine Board of Urology. So just going to my problem, it was one day I noticed some parang muta pizza kanan. So, which your reflex would be just to blink it out or yawn or do something. But it didn't go away. So when I had it checked, it was a slit lamp. I already had cataracts. It wasn't mature, but the particular cataract on my right eye was like a pizza. So it wasn't radial. It shaped like a triangle going straight to the center. And at first, I was asked, does it bother you? Because if it doesn't bother you, we can leave it alone for now. I said, no, it doesn't bother me. 3 days later, it was bothering me. Because now that I knew that what it was now bothering me. And so I went through the process of having my eyes checked for the surgery. It was really comprehensive. I think there were problems with my prescription.
Okay, but Dr. Jean here used to be very highly myopic. His grade was close to 900 plus on one eye and 1,000 plus on the other eye. So after doing the workup for him, turns out that the biometry reading, we needed a lens, and he was also astigmatic. No?
Yeah.
So we needed a lens power of roughly, on the right eye, 2. Oh, see, they all panic.
2?
2. And on the left eye,
Sorry,
1.
I don't know what that means.
Yeah. Normally, for your, the patient's benefits, the average Filipino eye would probably need a power of 1,600 to about 2,500. And you needed a 200 and a 100.
Okay.
And he's being a surgeon, of course, I said, well, you probably also want to be, be able to function for far, for your surgical work. And then, knowing him since he was much younger, and so was I, he does a lot of computer work. He's very into enjoying graphics and games, right?
Yeah, computer and urologic surgery has a similar distance, so
Yeah.
it worked out okay.
So I told him immediately that you're going to need a customized implant. Your implant will not be readily available. We will not be able to correct you with a presbyopia correcting IOL. And I said, of course, you could just become, choose a monofocal, which is readily available, but then he'd have to wear glasses. And of course, he said, well, if you had the opportunity to finally become spectacle-free, why would I choose glasses? So the process was to educate him as to what his options were. And because it's going to be customized, I said, we're going to have to wait. And he was a very busy surgeon, he still is. So the question was, are you willing to wait a few weeks? And this was 2018, right? So I said it might take about 3 or 4 weeks at least for the implants to arrive.
So it became 2019
Yes.
by the time it was done.
Okay. Yeah, so yes, it was very close to COVID, or did we reach COVID time?
No, we didn't.
We didn't.
We didn't. But remember, I got an injury in my leg, so I had to stop practicing. So when I stopped practicing, I said, let's do it. I'm not doing anything anyway.
Right, so we found a window of time wherein, we realized, okay, we can actually do this because you're not working anyway. So it was always this thing about how long will you recover, how well can I see right after, can I go back to surgery, and what was your
I was on a
experience
wheelchair
with that?
then, so
Yeah.
might as well get my eyes checked while my legs are healing.
So when we finally did the surgery, we did femtosecond laser cataract surgery, and then we eventually did the the bisegmental IOLs, similar to what Cesar had put into Dr. Jojo Aquino.
But you did it on the same day.
Yes,
Both.
and we did it on the same day, sequentially. Of course, this normal question would be, is that possible? So how did you go
Well,
through
they
that?
told me, well, if you do it on the same day, you won't be able to use your PhilHealth on the second eye.
Yeah.
So I said, how much does PhilHealth give? And they told me, do it at the same time. I'm not willing to wait. So there you go.
And
It's a good thing he agreed.
And post-operatively, how did you function? Because that's the most common question patients will have is, how am I going to function if both eyes have been done on the same day?
Actually, functionally, there was little change. I mean, there was slight irritation maybe, but immediately after the surgery, in fact, we had lunch, so there was a lot of glare. But by that night or the next morning, functionally, it was close to normal. It was just cosmetic. I mean, you know what the eye looks like immediately after. It was, you know, it's not very presentable in public. It's a good thing I had those glasses. So that was the only problem. It was scary looking at first, but functional-wise, it was okay. However, I had some problems reading, so I was planning to get some reading glasses. Then what did you tell me?
Well, initially, because he was a very high myope, reading for him was really, really close. And so I ended up choosing an Mplus X to give him that amount of reading. Then I said, you cannot read the way you used to, right? So it's going to be a little bit farther than before. And I said, maybe, you know, rather than coming forward towards your screen, you sit back more relaxed, because that's more or less where the Mplus X would work. And
yeah. So I was having some problems reading close. So, but he told me you should try without glasses. Try reading. So, what do you call that? Sensory?
the neuroadaptation.
Yeah,
So I discussed
neuroadaptation,
neuroadaptation and the neuroplasticity.
Okay.
And I said, if you keep trying to use a pair of reading glasses, your brain stops trying to use the bisegmental part of your
So-
implants.
In a nutshell, it worked. But this is what I noticed. Just for, I'm not sure if you know about this. Since I was a high myope, and let's say I couldn't see something far, my reflex is to squint. So then I'll be able to see it. But I noticed after the surgery was the other way around. If I open my eyes, then it becomes clearer. So it was the opposite of the reflex which I used to do. It took a little time to get used to it. I still squint every now and then, but then I remember, then I just open, oh, there, that's better.
And how did your batchmates, your colleagues, your friends react when they realized there's something missing? You know, you're not wearing your thick glasses.
Yeah, I was wearing bulletproof glasses. It was that thick, and I was wearing contact lenses when I was younger. When you know,
We were both younger.
we were both younger. Yeah. It was important not to wear glasses then. You know why? But after I got married, then I was wearing the glasses, and I've been wearing them since I was 9 years old. So you can imagine, almost all of my life, I wake up, I couldn't even see the clock. When I read, it has to be this close. So when I swam, couldn't see anything. Take off your glasses, go swimming, couldn't see anything. Now it's obviously I can see a lot better when swimming and going to the beach, etc. So it was let's put it this way: the effect on the quality of life is really dramatic. I'm sure you know how big that effect is. As far as my work, there was no problem with work. Surgery-wise, was the same. We do laparoscopic, so we're looking at the screen, so we could still see everything. But it was nice because now if I wear some lenses in front, I don't need to wear it in front of my glasses. So I don't need to wear anything. I just wear my headlamp and everything, and there's no bothersome spectacles outside. By the way, I am completely spectacle free. Far, middle, reading, everything. I can do everything without glasses. Thank you.
Very nice experience. Thank you for sharing with us, Gene. If you have any questions, we're here. If not, we can proceed. But anyway, if you come up with something, we'll still be here for the rest of the lunch symposium. Thank you.
Yeah, I need to thank you. Kulang na kulang ang thank you ko sa'yo.
Thanks, Gene.
Okay, so I'm Carlos Naval. I'm an ophthalmologist, obviously. That's why I'm here. So this on my left is Kai. She's also a doctor. I operated on her.
3 years ago.
Yeah,
2020.
left.
Right.
Right. Yeah. So she's my sister. She is also married to an ophthalmologist, Dr. Ding Lasan. So, of course, the pressure is there to do perfect surgery. Her left eye, no? Her right eye, we did her right eye, had a metabolic cataract. And I think it was disturbing you, right? How was it disturbing you?
Yes. I realized that I had a cataract at first because I could now read without my glasses. So initially it was good because my eyes became clear. And later on, when I had to renew my driver's license, they changed the chart. They jumbled it up. So I couldn't read it. And then, and when I drive at night, I'd see glare, like it was really, really bad glare. Like all the lights would be like fireworks. And so when I told my husband about it, he said, "You better go to your brother," because he didn't want to have that problem of getting nagged every day. Same as Cesar. So, yeah. So Carlos then checked me, and it was COVID at that time. Yeah. And actually, our father just passed away at that time. And after he passed, siguro after around 3 or 4 months, that's when I finally had the surgery, because Carlos told me, "Oh, there's a nice lens for you now. You know, maybe we should do it already." So that's how I went to have the surgery.
So at that time, we also had the FLACS machine, the lens AR. So we took the opportunity of using this technology. The lens AR is a femtosecond laser. Being able to control the capsule rexis very well, and because my sister is also a little bit her PD is very wide, just like mine. We anticipated that her visual axis may not be in the same place as the optical axis. So we used the FEMTIS IOL. The FEMTIS IOL, part of the FEMTIS IOL, the posterior haptics get placed in the bag, and then there are tabs or flanges on the lens which you can now use to enclavate the lens to the anterior capsule, so that you can actually control where the center of the lens will be. Unlike C-loop lenses or other lenses, even the LENTIS, when you put the lens in the bag will determine where it's going to be centered. The FEMTIS lens is unique because since it's enclavated in the anterior capsule, it doesn't move no matter how much contraction occurs in the bag, as long as it doesn't subluxate, of course. So we did the surgery by femtosecond, and maybe Kai can give us that experience on. The femtosecond is done in 2 stages. The femtosecond laser is done without prepping the patient. Actually, you just need to dilate the patient. The patient, the eye is still, there's no asepsis generally. So it's done in a non-sterile environment, or rather maybe a clean environment. Doesn't have to be sterile yet until they go to the OR for the final stage, which is the lens extraction and IOL implantation. So Kai can give us her experience about that procedure if she remembers 3 years ago.
Yeah, well, it was very easy. Like, you just lie down and then the laser's done. And then after that, well, maybe, you just have to like dress up and then go into the OR. At that time, it was COVID, so it was a little difficult because of the wearing of the mask and all that, and you have to be careful with everything, like even your hair is wrapped and all that. So just that, but it was okay. It was not anything scary or, like I
Did
I
you
was
experience
relaxed.
any pain?
There was no pain. I couldn't even feel any pressure on my eye. And after that, I was totally fine. I didn't have any, I didn't look like I had surgery. So for a woman, that's really nice. Like you don't have any bruises on your face or any signs that you had anything done.
So what did you do after the procedure, after the surgery?
Well, yeah, it was COVID, so I just had to rest at home, but I could already see through the shades, and my other eye actually also has a cataract, but it's still young, so I could already see clearly. The colors were already brighter, and it really made me, feel excited about. It was like a new life because you can see everything that's much clearer that you didn't realize that it wasn't pala clear before.
So the model of lens we placed in her eye is a FEMTIS Comfort. It has an add power of about 1.5 on the IOL plane. That gives you about 0.75 reading. So how's your reading after?
Yeah, actually a lot of my friends ask me why I don't wear glasses. So I tell them about the lens. And I don't need glasses, not for distance, not for intermediate, and not for reading. It's so liberating.
So even putting makeup?
None. You don't need anything. You just need a magnifying lens to twist your eyebrows.
So right now you go around without glasses, but are you able to read small print or?
Yes, I actually can read documents like almost, maybe that's near J1, because I've been reading very, very small documents, and it's not a problem with me. And I can easily adapt to, menus or intermediate reading or distance. So I really like the lens. I'm happy with it.
So this is quite actually a surprising happy result, because the Comfort is not really meant to be totally presbyopia correcting. But in some cases, especially when the surgery is done precisely, and that again is because we're able to do that with the FLACS, it's one of the things that gives us confidence that the patients will see more than they expect and even more than we expect. So if there are any questions from the audience, from the husband or any other relatives in the audience. So if there are no questions, thank you very much for listening to us. I'll turn you over to the next pair.
Good afternoon. My name is Adel Samson. Dil, you couldn't get me a better picture than that? Hello. This is my godfather, Tito Ed Pascual. He is a doctor. He was the former medical director of UST, also a department head of clinical pathology. Maybe you can add some more, Tito.
Good afternoon, everybody. Well, as Adel had mentioned, long time ago, I used to be in the academe and the administration of UST Hospital. And at the same time, I'm practicing as a pathologist. And then, at that time, my bread and butter was a good eyesight. To be able to distinguish normal from abnormal cells under the microscope. Now, when I retired, I was told, I was being examined by several ophthalmologist friends of mine, including Dr. Samson, that my cataract is already mature, quite big, and needs some surgical intervention. However, oh, by the way, my wife earlier, 10 years ago, had her IOL. And then, at that time, I was too adamant and hesitant to undergo under the knife. So I asked several people, several old ophthalmologists. They examined me, and the first thing they asked me, can you see across the street a guy or any print matters there? And I said, yes. So the old ophthalmologist told me, oh, you don't need surgery. Your vision is okay with your eyeglasses. And then some younger ophthalmologists like Dr. Samson tried to warn me it might lead to glaucoma. So when I heard that from Dr. Samson, I went back and went over my old ophthalmology textbook. And true enough, it says there, one of the complications of cataract is you might develop glaucoma. And our glaucoma is too painful, and you can get blind. Okay. So, another thing, in that old ophthalmology textbook, whenever there is eye surgery, they used to inject somewhere here. Oh, it's painful. So I was too hesitant at that time. But finally, upon the persuasion of my wife, who is much younger than me, I finally agreed to have IOL. But my consideration was that because I'm afraid to develop glaucoma, that is one. And also, I wanted to retain my good vision using my old spectacle. And so, when I agreed to undergo under the knife with Dr. Samson, I asked him, make sure, don't do it in less than 10 minutes. Do it in 20 to 30 minutes for me to have an assurance. He said, oh, I'll do it. So finally, they did it at the old UST hospital. And mind you, all of the ophthalmology residents were all around watching the procedure. So that's it. And then 3 or 4 days thereafter, the other eye was done by Dr. Samson. Right after surgery, he asked me, oh, can you see better? Oh, yes. Did you find any changes? No, there's no change. The same thing when I'm wearing my eyeglass. So that's it. So from that time on, I was able to get rid of my eyeglasses. The only thing I lamented was that I can no longer display my variety of eyeglasses. You know, the Oakley, the YSL, and etc. Forma, ika nga. But nonetheless, we don't need it anymore. I can see distant vision, and even my peripheral field of vision became better. So that's my experience.
Thank you, Tito. I have a few questions, Tito. How was there adjustment period for you after surgery? Oh wait, incidentally, I plugged in both Comfort, both eyes, and I made the left eye a bit, the non-dominant eye. I targeted -50. No, so just to let you know.
Well, actually, the day after, I underwent the usual examination of trying to read. Was it Snellen something? Okay. You said, okay, perfect. No, I never experienced any adjustment at all. As if nothing has been done. Meaning, if I'm going to compare me wearing my old eyeglasses, I do not know what's the grade 30 or something, it's the same. It's the same. No adjustment whatsoever. I never experienced any kind of adjustment.
I actually asked him before the procedure, of course, what he required. Well, being retired, he just needed to be able to see his text and watch TV and, the usual stuff. So I took the liberty of choosing the lens for him. And I kind of thought that this was the best lens for his purposes. No? Prior to his surgery, si Tita Baby, the wife, had her surgery first. That was like 2 years prior to yours, no? Tita. We did yours during pandemic, no?
Yeah.
Pandemic tayo niyan eh. Yeah. And so Tita was the guinea pig. He wanted to make sure that Tita had a good surgery and good vision. She's also spectacle free, and I'm quite happy that Tito Ed's vision is, well, spectacle free. Minsan may chamba ka na eh. May chamba talaga. So, yun, Tito.
Yeah, by the way, the final decision to submit myself to IOL was my wife. Because according to her, yes, you should get rid of those eyeglasses because you look old. And second, start dyeing your hair. Because a lot of people might be asking me if that is your dad fetching you from some social gathering.
So, with that, I guess that says it all. I don't really have to add anything. Maybe if you have questions now or later, you can just throw them later. Thank you. So, thank you, Tito.
Okay.
Dr. Ed Pascual.
Good afternoon. I'm Cesar Heredia. We are the fourth pair and the youngest pair. No pun intended. So, we work together with Ricky. I am the head cataract and refractive surgeon at Boro LASIK Center. And we have been working together for 20 years, since 2004. And we were both wearing glasses for many, many years. And when we got certified with Presbymax LASIK in August of 2020, I was the first patient. No? So I had PRK, I had a little astigmatism, which was very bothersome. And I was the first guinea pig of the Presbymax PRK. Done by our colleague, Dr. Jerome Sarmiento. And I was very happy with the result. So I started encouraging my colleagues who were wearing glasses at that time. And one of them, we have a rule in our clinic that if you wear glasses, since we are a LASIK center, we'll do your LASIK so that everybody in the staff will not have glasses. So I told Dr. Aranza Mendez, Tol, magpa-Presbymax LASIK ka na, di ba? Kasi maganda talaga eh. And mind you, until now, 4 years after, I'm J1 and 2015 on the right eye and J1 on my left eye. So, but then he didn't like LASIK, and we dilated his eyes, and I think we saw a starting NS1 cataract. So what made you decide between refractive and lens exchange? Actually, it's a lens exchange over Presby Max LASIK.
Okay. I'm Dr. Ricky Mendez, as mentioned. We run Boro LASIK Center. We're located in SM Mall of Asia. For all your presbyopic or laser needs, you can visit us 8 to 5.
We are just
Monday till Sunday. Thank you po.
We are in the north wing, not in the south wing.
Anyway, the reason why I underwent the lens exchange, because the chest told me that I had cataract, which
Starting cataract.
It was him who said that I already had starting cataract. So since I'd like to cooperate with the management of not having glasses, actually my vision was still good except for reading, which is very bad. So I wasn't able to text while driving anymore, which was my favorite thing to do. So I asked Dr. Heredia, of course, who else to ask but my partner, and syempre siya yung boss ko, siya yung the best optosurgeon for me. So we planned doing the refractive lens exchange, which he did.
And at that time, I believe that the LENTIS IOLs was the best choice. So we prepared, and we intended a comfort lens on the right eye and the MF20 on the left eye. And I gave him the option, Tol, do you want to be done one day this week and then a few days after? And then he decided, okay, let's just do both eyes at the same time, sequential bilateral.
That was actually not very accurate. Dr. Heredia really does bilateral refractive lens exchange. But yes, I opted to have it because of my belief in the skills of my partner, of course. He was able to do it at the same day. Within 15 minutes he was able to do the surgery on both of my eyes. Okay.
And then when I got to the operating room, there was anesthesiologist. Sabi ko, what's going to happen? And he said, I prefer my patients to be always awake. But he preferred to be sedated. So, yes.
All my patients, I really wanted to experience the euphoria of being sedated. So I asked this anesthesiologist to do it. So I have a story there. So when I was sedated, I told Ches, he was starting with my right eye, sabi ko, Tol, parang awa mo na, wag mo naman bilisan. Sabi ko ganon. So I asked him also not to be very fast. So initially on my right eye, I was still conscious. He was doing it, so he did it in around 5 minutes. But I fell asleep. So that was the problem. And then I woke up. When I saw the video, when he did the other eye in 2 minutes. So I have the video, but I will not be presenting it. So that's what I'm scared of during the surgery, was like, then I realized when I was lying down, I'm risking a lot for this because I'm an ophthalmologist and I use my eyes. But really, like what he said, I trusted first the technology and of course my surgeon. And during that time, the lenses were available and were good, as that of the Telion lenses, the Comfort and the Plus it was free, so I took that opportunity to have it.
Sponsored by the Med. So the next question is, how was the recovery at all?
Yeah, just after the surgery, when immediately I was able to see at near. So we were planning I was planning to help him do surgeries, but he said that I may go home. So when I went home, I was texting while my driver was driving, because I had to use a driver then. And then after the next day, it was already clear. So in fairness to the lenses and to the skills of my surgeon, it was very clear. 2 days after, I was already doing surgeries in the clinic.
Very good. So, ano ba? It's been 4 years So we had to do YAG capsulotomy this year for both eyes. Maybe that's a question I wanted to ask. If you says had to do capsulotomy in Jojo's eyes and also in the other pairs. But we had to do capsulotomy on the left eye first for Ricky, and then just recently we did capsulotomy for the right eye. And any issue right now? Are you 100% spectacle free? Playing golf, doing surgery, driving?
Yeah, driving is no problem. Playing golf is still, a challenge. But I think it's because that I'm a doctor and I'm so conscious with the vision. Any slight changes in the clarity, so I was really complaining. So I had to do YAG laser this year. So it's back to normal and I'm doing good.
Sometimes you complained of when it's dark, then you wear some correction spectacles.
Yeah, initially, I don't know if the experts are here, because I have a very large scotopic pupil. So initially, the distance when it comes to very dark or a little less lighting, I experience not really glares or halo, but a decrease in the quality of the vision. So that was initially on the first and second month. But right now it's better and I got used to it na. So it's good.
So we are spectacle free for the past 5 years and should be in for the next many, many years. Thank you very much.
Good afternoon. That doesn't mean that I did the surgery on myself, okay? So it's just me. I was trying to get the patient to come, but the patient refused. Okay, so let me give you a background of the case. Oh, here. It's a laser pointer. This is a case study. He's an active, independent, 55-year-old medical doctor complaining of difficulty of doing procedures. Visual acuity was 20/40, J4 for both eyes. Stage 2 cataracts with fibrotic capsule. Heads the hospital aesthetic center and president of PDS South. Does minor and laser aesthetic procedures. Wears protective colored glasses or visors. Drives at night very often. Drives manual, drives matic, and drives left hand, right hand, and drives the back seat as well. He works with her laptop daily. She loves to curl up in bed and read books in low light daily. She loves to shop and is a price tag conscious person. Luckily for her husband, it's not daily, her shopping. So guess who this patient is? Yes. So it's my multifaceted dynamo wife. So this was presented to me. I soon realized that, like what Cesar said, we will see each other every day. Worse, she will see me every day in everything that she does. So I need the the participation of the audience. Can I make a mistake? No. Can I leave it to chance? No. My happy life, does it depend on it? Yes. So this is what I did for my wife. Okay. So again, I don't know how many times, but I made sure that I had a precise, accurate, reliable biometry. pentacam guided, hydrated cornea, and an optical lace cap. I don't know how many times. I did a comprehensive cardio clearance, but it was not for her, it was for me. And of course, my choice of the IOL, because of, she does a lot of these things that I mentioned beforehand. My ideal choice, okay, then like in other words pala, like most wives, she wants it all. So my choice now will be, and to tell you frankly, you remember this adage? Under promise and over deliver? Well, it does not apply. So I did my usual, what I call Cymmer formula. Anyway, Dr. Dinglasan would attest that that's what we call each other before. It's a formula wherein my target refraction for this comfort lens, I use a comfort lens on her, was a -50 on the non-dominant eye, on the dominant eye, and -0.75 on the non-dominant eye. That's how I play around with the lens. So my choice is, of course, the LENTIS Comfort. That's my go-to lens almost every time. And luckily for me, she's left-hand dominant. The right eye, non-dominant eye, was on target, 0.75, with a vision of 20/30 J1. Left eye was -50, very lucky for me, 20/25 J2. So binocularly, she was in the perfect place. So I tested her recently for the focus curve. It was very, very flat. Her contrast was excellent. And of course, because of that, I am still her superhero. Yes, success. Thank you very much. The mere fact that me and Cez are here talking to you means the surgery went really well. Thank you.
Okay, we're now opening the floor for any questions, maybe your own experiences. And if you want to ask about, how we use or play around with the lenses, you're free to do so. Just step up to the mics, I think. We have several mics. Adel has some more tricks to share.
Just a comment, no. Si Tito Ed actually wore progressive lenses prior to the surgery. So parang he told me that I don't want my vision to change and just want it to be like this. So parang, progressive. So I plugged in Comfort, and surprisingly, because Comfort only gives you a -75 reading, di ba? Plus 75 reading. So, I've always experienced this with my patients. Parang may magic. Carlos and I were talking about it. May magic siya na, biglang may near. Bakit ganyan? And the near is not even arm's length. It's like 30 cm. So, may chamba. May chamba talaga si Comfort, no? Carlos, you had FEMTIS, no? That's Comfort also. Did you experience the same thing?
Yeah, she just told us that she can read everything, even up to J2, J1.
Yeah, usually, I think the other surgeons will attest to this also. When we use the Comfort, we actually aim for the first minus. No? And it's really not a problem, even with distance vision, to have a little myopia. From my experience, even if the patient ends up slightly myopic, even to about 0.5, sometimes they can even be 20/20. And they can read Jaeger 3 or Jaeger 4, which is fine. And that's why, of course, you have to really have chair time with the patients, no? And really really get down to the business of what they expect after the surgery, ergo what they need, depending on their lifestyle, right? And their visual demands. So you have to go through that. My go-to lens really is the Comfort. When I feel that it is really what is the best distance and intermediate lens for what the patient expects. And if the patient is happy with the Comfort in the first eye, then that's what I put on the second eye. You know? But if they want a little bit more reading, you can go with the MF20 or the MF30. As far as dysphotopsias, I haven't had a patient who complained about dysphotopsias. Even with the MF30, which does have some reports of dysphotopsias, but they're probably with patients who have light iridis, no, the Caucasians. I haven't found them in darkly pigmented eyes. No dysphotopsias. Definitely with the Comfort, wala. And even the MF20. But surprisingly, my usual combination is Comfort and MF30. So far, wala. I think we're fortunate with that. No? That our having dark iridis has really lessened the incidence of dysphotopsias in our patients. Yeah.
Hi, Cesar.
Yes.
Yeah.
Yeah. Why?
Yeah. Since we have so many experts in using Telion lenses in this meeting, perhaps maybe some of the experts here would like to share their experience. Especially, Telion has this range of lenses from Comfort, MF20, MF30, and MF30 Plus. And I understand from your talk that you have mix and match some of these lenses. Perhaps some of the experts here would like to share their experience, whether they have do the mix and match, and how is the experience, and how good is this mix and match in their experience, because I'm sure there are many participants here who would like to know, with this availability of this wide range of lenses from the similar platform and various in terms of performance, perhaps it is a very good lens where they can actually mix and match and get the best out of the lenses.
Yes, would anyone like to share their own experiences with the lenses?
Or maybe I will just start off with my own personal experience. I've started using Telion since more than 10 years ago. That time, my go-to lenses is basically MF30, MF30 Plus. So it's more for near and distance. Then subsequently, I realized that if I mix the MF30 and MF20, they are the most happier patient actually. Okay. Then I actually did not use Comfort that much at that time. That was the earlier stages. But the last few years, because of the EDOF phenomenon, and also occasionally, especially MF30 Plus, some of these patients do have night times a bit of visual disturbance in some cases. So I'm actually like you, have a changing trend towards more of using MF15, which is the Comfort, and combine it with MF20. Not so much with MF30 in my personal experience yet. So that's me, that's my practice. I do mix and match MF20 and MF30, and also Comfort. Of course, Comfort, again, like what you do, if they're happy with the first eye, the second eye do the same, or they prefer to have slight improvement in near vision, I aim a little bit myope in the second eye. That's my experience. So maybe the other experts would like to share their experience in a mix and match manner, so that our participants here can benefit from your sharing. Thank you.
Okay, for mix and match, of course, the technologies have to be matched. I mean, if you have a diffractive lens in one eye, you can't put a refractive lens on the other eye. That's going to lead to a lot of confusion, a lot of chair time explaining to the patient why the phenomena on the right is different from the left. So one of the things, if you have to mix and match, you have to use either both diffractive or both refractive. The good thing about this lens, the lenses of LENTIS, is that if you have a monofocal in one eye, it's safe to mix it with a bifocal on the other eye to give the patient better reading vision. Particularly patients who have been done earlier and they use a monofocal lens was used in the first eye. You can actually use a bifocal for the second eye, and they will have no problems with it. As far as mixing and matching the MF20 and MF30, one of the things that the MF20 can do is give intermediate vision. The MF30 will give near vision. We find that after doing the first eye of the patient, they don't really have this gap. No? So if we did an MF30 in the first eye, we don't necessarily use an MF20 in the other eye because their intermediate vision is also good, despite the fact that it's actually the MF30 is designed for very near vision. So although we intend sometimes to mix and match, we find out that because of the satisfaction rate with the first eye, we just use the same lens.
There's a question from Tita Baby, the wife of Dr. Pascual. Ano nga ba yung... Lapit ako. Tita, you were gonna ask a question? No.
I'd like to take the opportunity to ask the top-rank ophthalmologists around here, if I live to be 100, can I still have the same kind of vision? Dr. Cabrera?
I think the answer to that question has more to do with your retina than your implant. So if nothing happens to, your sensors and your retina, then you'll be fine. However, if you have systemic diseases that can affect it, including diabetes or maybe really bad hypertension, other problems inside your visual axis, visual system, may lead to deterioration of your vision. The implants are inert, made from material that does not react to anything, in your eye. So theoretically, it will last a very long time, even outlast us. So I've gotten questions similarly from other patients who ask me, so since it's going to last a lifetime, if I go ahead, can I give it to my wife? Or can I give it to my daughter or something? No, that doesn't work. But it will theoretically keep your vision as good as it is now.
Actually, Tita Baby was asking if Dr. Naval and Dr. Espiritu would opt for these lenses when the time comes.
Well, just like similar to what your husband said a while ago, my wife's the opposite. She doesn't want me to look any younger. So not for some time.
Well, it's a definite yes. Since I took the chance and I believed in the lens, having put it in my wife, then I would do the same for mine.
Well, can I ask a question? I'm the husband and brother-in-law of Carlos. So my first question is, since you all have background in putting in this lens, some of you use FLACS, some of you just apparently use just phaco. Am I right? So the question is there a difference? All your results are spectacular. You know, you have the same. So is that a testament for the lens being so? If it were a racket in sport, malaking sweet spot niya para tamaan yung bola. So in terms of the optics, isn't that a testament already to say that because you have used even the same lens in when you do a manual technique and not a robotic computer controlled, you know, it is actually something to, it's a testament to the lens technology, is it not? Do you all agree?
Yeah, I think
I'm sure the skill is also there, but I'm just saying you're all equally skilled and you do phaco manually and you do it also. No, you're all very equally skilled, but it has to, would the lens really matter? I guess in my opinion, it's really the way that the lens, and then the follow-up question to that is there any tips or tricks in rotating the lens to a position where it benefits the near more? Even if, you know, that the nature of the refractive is a sweet spot, but is there any other, nuance that you must know when you use particularly the LENTIS Comfort lenses? And yeah.
So before I forget the first question, the first question is actually it has a bigger sweet spot because if you compare it to the diffractive lens, the diffractive lenses have rings, and you have a lot of light loss just from it being diffractive. Secondly, this one is a refractive segmental, so you obviously have, one is you have less light loss, and you have almost a 50-50% distribution between the near and the far. So definitely you'll actually take advantage of that in terms of the visual quality of near and far. The second question is, the position. Well, the only thing that you can actually rotate the lens anyway, and you can put it horizontally, vertically, at an oblique angle, and you'll have the same result. It's just that you have, what I do to make sure that the patient can see well is that it has that eyelet in the center. I ask the patient at the end of surgery to look at the microscope light, and I make sure that the microscope lights, the Purkinje images, fall in that eyelet. Otherwise, I'll still rotate it until it does, no? Because that's one of the things I think that matters a lot. Of course, if you have a toric version, you don't have that choice.
Yeah, well, Carlos was talking about the FEMTIS. No? Well, as far as femto versus traditional phaco, the advantage of femtosecond laser is really being able to have a consistently round and centered capsulotomy or capsulorhexis. And in Carlos's case, in cases where you have a lot of angle kappa, you can actually position the capsulotomy so that more or less it corresponds to the axis, the visual axis. No? So that's the advantage of the laser. But because of the design of the LENTIS lenses, which are plate haptics, the size of the capsulorhexis and the 360 override, for me, is less important than if you did a manual capsulorhexis or used for example, a C-loop lens, because the plate design actually keeps it more stable, even with not a totally 360 override. Even with the contraction, you have less tilt because the plate haptics kind of keep it stable. But of course, that doesn't mean that you won't try to make a 360 override, but it's more forgiving. The only, probably, if you consider it a challenge, is the actual insertion. Some surgeons may maybe anxious about inserting a plate haptic into the bag, no? But usually with a two-handed technique, it's quite easy, and just depressing the trailing part of the lens into the bag by pressing down is actually very easy and less stressful to the sonios. Not the same stress that you would imagine looking at the maneuver.
Just to add, I've found that the orientation of the lens, apart from the Perkin-J reflexes, the orientation of the lenses have been a bit forgiving for me when they're oriented in this fashion. Parang temporonasal. That's probably the most forgiving orientation of the lens. So, crosswise siya. Ganun. There were times when I actually just forgot the orientation, so baliktad yung lens. Yung ano niya, near component was superior. So patients were complaining. I had one patient lang, Doc, mas maganda yung near. Yung far hindi ko makita. But on the other eye, the far is good. Okay, so I had to check, and then true enough, my orientation was baliktad. So I had to go back in, rotate the lens. And to be sure, my orientation was temporonasal.
Yeah, well, we have to end the session to give way to the next. So we'd like to thank everyone, especially the speakers and their guests, those who really took the time and effort to be with us and to share their experiences. So we thank you all very much, and all the great surgeons and the audience who came in to actually learn more about the lens. Thank you very much and have a great day.